Today we will talk about hypertension. Hypertension, also called as high blood pressure, is often called as a silent killer, having no symptoms in many cases. But what is hypertension, really? First, let's talk about the heart. The heart is a big mass of muscle whose primary role is to pump blood through the veins and arteries to supply our body with oxygen and with other nutrients. As blood is passed through our arterial walls, the force of blood exerted inside is called the blood pressure. 120/80 is the normal blood pressure. Anything that goes beyond that range could either be hypotension, also called as low blood pressure. Hypotension can be dangerous. It can make you fall because of dizziness or fainting. Or hypertension, when it goes higher than the 120/80 systolic and diastolic reading. To further understand, let me show how hypertension happens. Hypertension occurs when the body's smaller blood vessels, the arterioles, narrow, causing the blood to exert excessive pressure against the vessel walls and forcing the heart to work harder to maintain the pressure. Hypertension is the most common cardiovascular disorder and could result to a more serious disease. There are two classifications of hypertension, the primary hypertension and the secondary hypertension. Let us talk about these two types. First, the secondary hypertension is high blood pressure that's caused by another medical condition. Secondary hypertension can be caused by conditions that affect your kidneys, arteries, heart, or endocrine system. Secondary hypertension can also occur during pregnancy. Secondary hypertension differs from the usual type of high blood pressure, or the primary hypertension or essential hypertension. Primary hypertension has no clear cause, and it's thought to be linked to genetics, poor diet, lack of exercise, and obesity. To further understand, let us seek the help of an expert, Dr. Strange.
Hello there, I'm Dr. Strange, a cardiologist. A while ago, 3 patients arrived in my hospital. They all have hypertension, but they are not all the same. They are in different stages, and these stages are based on their blood pressure. Our normal blood pressure is at less 120 systolic and less 80 diastolic. When it rises up to 120 to 139 systolic pressure and 80 to 89 diastolic pressure, it is called prehypertension. When the systolic pressure rises to 140 to 159 and the diastolic goes up to 90 to 99, it is called the stage 1 hypertension. And it becomes stage 2 when the blood pressure goes up higher than 160 systolic and the higher than 100 diastolic pressure. Stacy has a blood pressure of 130/80. What stage of hypertension do you think she has?
Yes, she has prehypertension. Treatment for this stage are exercise regularly, eat plenty of fruits, vegetables, whole grains, fish, and low-fat dairy. Cut back on dietary salt, sodium.
Next patient is Bruce. He complains about his severe headaches, visual problems, fatigue, chest pain, difficulty in breathing, and irregular heartbeat. His blood pressure is found out to be 150/99. He has stage 1 hypertension. Bruce was then treated with one of 3 classes: the angiotensin converting enzyme or ACE inhibitors, calcium channel blockers, or diuretics. But there are also natural ways to lower blood pressure, which includes reducing salt intake, maintaining a healthy weight, exercise, limiting alcohol intake, and avoiding tobacco. She is rushed to the hospital complaining about palpitations, flushing, headaches, and sweating. After further tests, it was found out that she has a blood pressure of 170 over 100 millimeter mercury. And yes, you got it right.
She has a stage 2 hypertension. So she was given a treatment of the possible drug of choice like angiotensin converting enzyme or ACE inhibitors, which helps relax the blood vessels by blocking the formation of a natural chemical that narrows blood vessels. Calcium channel blockers, which help relax the muscles of your blood vessels or slow the heart rate. Diuretics to help the body eliminate sodium and water, so reducing the blood volume. Beta blockers that reduce the workload on the heart and open the blood vessels, causing the heart to beat slower and with less force. Angiotensin II receptor blockers, which help to relax the blood vessel by blocking the action, not the formation, of a natural chemical that narrows blood vessels. Direct renin inhibitors, such as aliskiren. Aliskiren relaxes and widens the arteries by preventing the action of renin. But other than her hypertension, she was also diagnosed to have a condition in her kidneys. That is why she was also treated with medications intended for her other condition. Which among the 3 patients do you think have primary hypertension and secondary hypertension? You're right! Bruce and Stacy has primary hypertension, while Natasha alone has secondary hypertension because she had hypertension because of her underlying kidney disease. Take care of your heart, because your heart deserves to be loved for all the work it does. It started pumping blood before you were born, and it will continue pumping throughout your whole life. Remember that your heart is in your hand.